Hello everyone. We are going to talk about mental health patients today, their intricacies and the legislations connected to that. Why are we talking about this population? We need to talk about them because they're special needs population. There's a lot of things that we need to do and consider when dealing with mental health patients, especially under the Mental Health Acts, that we don't need to consider with other patients. They are high risk to themselves, they're a risk to others, there's risk of violence, there's considerations of restraints within the restraints of both the Mental Health Act as well as the Patient Restraint Minimization Act of Ontario. There's also the issue of hospital policy that applies in these cases. Our hospital policies do need some updating, and this will be happening. However, we have worked on making sure that the current order sets and the orders are compliant with our policies. We're going to talk today also about the mechanics of how to complete a Form 1 within the new environment. We are going to talk about some order sets. There's one for pediatrics and one for adults. They have been called admission transfer order sets, when in fact they're neither admission nor transfer, but we will correct this name at some point in the future. We do need to give special consideration to chemical restraints. They can either be ordered right now and have to be given immediately, or they can be ordered as pending or initiate later. They're not really PRNs because when they are pending, they are not really in effect. They are activated by the nurse once if they need to activate them. We do need to talk about the difference between chemical restraints versus using medications for sedation as anxiolytics for agitation. Even though the medications might be the same, the use is different. When you're using them for sedation for agitation or anxiolysis, you are using them as therapeutic rather than restraining agents, and standard patient consent comes to play. However, when you're talking about patient restraints, these are used to restrain patients even against their will if need be. And that is the major distinction, and that's why they are treated differently. If you are not familiar with Form 1 completion and its requirements, or with orders and CPOE and their requirements, I do encourage you to watch the videos with the QR codes provided before you continue this one so that what we say makes sense. Let's talk about how and where to complete a Form 1 in the new system. You notice that in my ED tracker, I have added a button to link me directly to ERDocs.ca. I will teach you how to do that. The next thing we're going to do is we're going to open the patient's chart. And then once you do, we are going to stack the patient's chart next to the Form 1 for ease of access. You do not have to do that, but that makes things very easy. You're going to make sure you are in the demographics tab in MPage, and what that will do is we'll give you the patient's name, and I'm copying it here using right click, or you can use Control-C, or not also the name, but also the address. I highly encourage you to copy and paste the name and the address from here into the Form 1 because any spelling mistakes in this will render the form invalid. Let's talk about mental health orders and mental health order sets. We're going to divide them into two types. The first ones are the orders you want to write on patients you put on a Form 1. They are in order, so you search for them wherever you search for orders. I'm using MPage here under New Order Entry. I've typed in ED Mental, and you'll see that I have three options. The first one is mental health for the adults, and the third one is for pediatrics mental health. They're both called admission and transfer, although in fact they're neither an admission or a transfer. They're an order set to take care of these patients. Now, once you select one of those, it'll go to your box. You click your box, you will see this dialog box, and as we said, whenever you get the urge to sign, don't. Modify. You modify the details, and this is what the adult order set looks like. It might look overwhelming at the very beginning, but really it's not. It's very easy. We talk about diets. You indicate if you've placed the patient on a Form 1 and issued a Form 42. There's some communication orders about counseling and withdrawal management if you need them, if you need a formal suicide scale to be done. You come into medications. And the first lot of medications are for managing anxiety and symptoms and agitation. These are not restraints. You can pick whatever you want and pick the dosage and the frequency. Side effect management medications are also there. There is an order about alcohol withdrawal and opioid withdrawal, and you can from here open the COS subphase. There's nicotine management and also the subphases for that. There's some analgesics. There's some labs if you need to order them, some urine studies. Then your consult to psychiatry, and if you need any other consults like mental health CAPS, RAM, senior mental health, child and adolescent mental health outpatient. Once you've picked what you want, you're going to go to orders for signature. That will take you to if you're missing something, and you'll be missing probably the reason in the consult, psychiatry or a form there. You're going to sign and you're done. This is the same thing, but this is the pediatrics order set or PEDS mental health admission transfer. It's a much shorter form with fewer fields. For older teens, if you need to use the adult, go right ahead. Here we don't have things like nicotine, etc. Let's talk about chemical restraints. Again, if you haven't already watched the order sets in CPOE, I highly encourage you to do so. Chemical restraints are an order, just like anything else, so you'll look for them wherever you look for orders. Here again, we're doing it in an M page under ED workflow. If you just type restraints, you'll get mental health medical restraints. You'll select that and you'll move on. And this is what they look like. So we've included all the medications here. For us, we're really interested in the top two from the emergency department. I am Haldol and I am lorazepam. You do have other options here that you can pick from. You also have EPS prevention. So you have benzatropine on the right side here. You can pick different doses just by clicking the down arrow here and pick from the doses provided. Again, you can change those later if you want. From there, you're going to choose either initiate now, and it's grayed out because there are no selections, or plan for later. Initiate now will put them immediately into effect and they will be given to the patient now. Plan for later will give the nurse the option to activate them down the road and use them to sedate the patient if need be. These, I think, will be active for about 24 hours after order. You click plan for later or initiate now, you click sign, and you move on. This is how the pending orders will show in the inpatient nurse's view. This is Care Compass. And you'll see this patient here at the bottom has mental health admission orders, but also has mental health chemical restraints that can be activated. They're right there so the nurse knows where they are. Once activated, they'll go to the patient SMART. How do you activate them? Just like orders, they live within orders. It's under orders, and here they are. Mental health chemical restraint planned. I do want to note that they don't show up under the medication list because they're not an active medication yet. They're not in the MARS. They are still just a mental health restraint order that's waiting to be activated. How does the nurse activate it? They go here, click initiate now. The reason is initiate a plan. And the reason you want to do that, because that way it does not require co-signature from the provider. It's already been signed. You hit OK. From OK, you go to orders for signature. You sign the order, and once you sign the order, they move to the medication list. Now there are active medications in the medication list, and they will show up in the patient's MARS. Let's demo a few things. We'll start by demoing how to add an ERDocs button, or any other button for that matter, into Cerner. First, let's demo adding an ERDocs.ca button to this bar. Hit the little arrow in here, add or remove buttons, customize. I already have this added, but I can add any other button. So let's add this, CNN.com. So I'll call this CNN. The URL is https://cnn.com. The easiest for you is to actually copy it from the browser and just paste it here. There's nothing there. I'm going to add that, close. And if you notice, there is now a CNN button here. If I click it, it'll take me to CNN. While this button here that I had added before is for ERDocs, and it will take me to ERDocs. Let me remove the CNN button because I doubt that I will need it at work. Let us now demo completing a Form 1. Let me do a Form 1 on this patient. I'm going to open the chart. I am also going to open ERDocs.ca. Now, where is my chart? I forgot my chart is right. Oops. No. I'm going to hold this and bring it over here to the edge. That puts it in the half. I'm going to choose ERDocs.ca, and here we are. I'm going to go here and open Form 1 and 42. And from here, I am going to go demographics. And from here, I'm going to select. You can right click and copy. And I'm going to paste that here. Now I'm going to go to the address, and I'm going to select the address. I'm going to select both lines. I can use Command C or Control C and paste it. I did it twice and paste it here. And now I can continue. Suicidal ideation with a plan. Suicidal ideation with a plan. 3 previous attempts. And of course you can use Dragon if you have Dragon enabled. I'm going to put in my time. And don't forget to complete your medical clearance form. And now you can print that to your favorite printer. Let's cancel this because we're not going to print this. The next demo we're going to do is how to use your mental health order set. Now let's demo ordering mental health order set. Open the patient's chart, and from my ED workflow, I'm going to do to new order entry. Now remember, you can do this from anywhere. You can do this from ED quick orders or anywhere you can search for orders. Let me search for ED mental. All our order sets have the word ED in them, and this is an adult, so I'm going to pick this one. That brings it here. I'm going to click that. Whenever you have the urge to sign, don't. Click modify, and this will open it in the orders. Now, I can give him a diet if I want to. Let's do a diet just for fun. Standard diet. Let's go back. Form 1 and 42 are done. For agitation, I'm going to use ODT olanzapine, and I'm going to give him 10 milligrams, Q6 hours. My other medications are going to be lorazepam sublingual. I'm going to pick that. I'm going to give him benzentropine, PO, 1 tablet Q8 hours if needed. I don't need a CO protocol. Nicotine, I can open the whole subphase if I want to. Just going to give him a transdermal. I'm going to give him some Tylenol. I don't need any labs. I don't need a urinalysis. Let's say I need a urine drug if I want to. Consulting psychiatry. Orders for signature. These are my orders. One thing is missing. Reason for consultation SI. Sign. There is an interaction. I'm going to override it. And we are done. Let's demo ordering chemical restraints. And what I will do is I'll demo them as planned, although you can definitely do them as immediate execution. I'm going to order restraints on this patient. While I can open the chart and do it like I did the first one, I'm going to do something different today. I'm going to go to medications or any one of those tabs. In here, I'm going to say go to orders. That will open and take me to quick orders, and I'm going to search for restraints. So I'm going to do mental health chemical restraints. Always modify, never sign. Let's take a look. I want to give this patient medical restraints when they need it. 2 milligrams of lorazepam. I want to do 10 milligrams of Haldol. Benzentropine if they develop extrapyramidal symptoms. I don't need an ECG. Now, I'm faced with the option of either initiating now or planning for later. If you initiate now, the nurse will give it now. That's simple and easy and follows every other orders. What we're going to do today is we're going to do plan for later. And we're going to sign this. You can change your mind and initiate it now. We don't want to. We're going to sign it as such. And we're done. Now let's demo how to initiate those by the nurse without the need for signature or going back to the ordering physician. Okay, so let's demo how the nurse is going to initiate my planned order for chemical restraints. And this is the nurse's view. And this nurse has 2 patients. Open the patient's chart. If you go to the MARS, where the medications are, you'll notice that the medications are not there. We're going to go to orders. Under orders, the nurse would have mental health chemical restraint planned. It's not initiated. Select that. These are the meds that were selected. Initiate now. It'll ask, why are you initiating this? It's important to initiate a plan because that would not require my co-signature because I've already signed the order. Okay. Orders for signature, the nurse signs, and we are done. Now, if we go back to the MARS and refresh, you will notice these 2 stat medications will be given right now. If you have any questions, you know how to get a hold of me. Otherwise, thank you very much for your time.